Your health is the most important thing you can invest in. Good morning, guys. This is Dr. Brenden Cochran from Interactive Health Clinic, bringing you another proactive health tip. Hope you had a fantastic weekend. Let's talk about what's going on and, kind of illustrate and recap some old ideas, but also go into some new things we're finding out. So one of the things I wanted to first start off with talking about is these stay-at-home orders, these lockdowns. They're really tough on people, both psychologically, mentally, and financially. And I agree, they do cause hardships and possibly increase the risks of other health effects. Totally agree with that. However, we also look at this data that's now published, and we see that those lockdowns, when they're used appropriately, and the stay-at-home orders, when used appropriately, do prevent deaths. So we see that this current one of the studies that came out showed that it prevented about 2.1 million hospitalizations and about 200,000 extra deaths currently going on. Now, they can't go on forever. Obviously, they're used in certain spaces which are like taking off like wildfire, like we saw in New York. Now, the balance that's not being done, as most of you are arguing, and I agree with you and see the complications, is there's rural areas that are unaffected by this or affected less by this that shouldn't be as hard. And we should also have diligent testing, diligent monitoring. And if something is taking off, then we have to clamp down a little bit and then we can move forward. So that way we're not overwhelming our hospital systems, etc. So there's a balancing act with this as we go forward. The other thing that happens is if we are proactive about preventing this thing from taking off, like we have in some areas of the country, then we don't need to do lockdowns for long periods of time. And part of this thing is about prevention and being proactive with your health. So proactive health, we've talked about, is optimizing your terrain. Prevention are things like hygiene therapy, understanding how to wear a mask and that masks actually work versus promoting all this bull crap about masks not working. Now, the biggest concern I have, and most of you have, is yes, masks are not 100%. Nothing's 100%. So there's still stuff that's going to get in. There's still people that are going to get affected. But again, the key part that I want to illustrate is I personally would rather receive a small inoculant versus a large bolus inoculant, which we see with a mask. Think of this analogy. If you have an air filter in your house that's reducing particulate matter in your house, allergens, etc., like that, it's not 100%, but it is getting the count down, which is reducing the amount of impact you're having on your body. Same thing goes on when we're using our clean room, when we mix certain medications in our clean room. We're using filtration to reduce the particulate matter so there's less likelihood of causing an issue with an infection, say, in a patient. And that's what's used in pharmacy. Is it 100%? Does it remove 100% of the particulate, virus, bacteria, etc.? No, it does not. It just reduces the concentration. Remember, when you have a smaller concentration, you're less likely to get this full-on infection. If you don't trust me and you don't know this, go leave mayonnaise or shrimp out on the table for 15 minutes or 30 minutes without ice or refrigeration and eat that, versus trying to eat shrimp or mayonnaise that's been sitting on the counter without refrigeration for several hours. You'll know real quickly which scenario is worse. And that's the same thing that goes on when you get a respiratory inoculus as well. Just like food poisoning, the more you get, the worse it's going to end up being and the harder it's going to hit you, versus the small one. You may not get any symptoms at all, and you may mount an immune response to that. So personally, I'd rather have a small inoculus versus a big inoculus. Now, if a person is wearing a mask improperly, could they get a worse infection? Yeah, it's possible. If they're touching inside the mask and then they're touching other areas, it's possible you have something now sitting in there that you're just breathing in over and over and over again. And I think that's where we've kind of failed, because we're going left, right of masks are good, masks are bad. instead of actually putting out a campaign educating people. Remember, education is power. So if we educate people how to properly wear a mask, our our percentages of outcomes are going to improve, versus if we just say, well, wear whatever crap you find around the house and give you no guidelines on that, which is kind of what's going on. We have no guidelines on opening, no guidelines on masks. If no guidelines are put out there and we're not actively pushing a campaign for that, then people aren't going to understand that unless you're in the medical profession. Then you understand how to properly put this stuff on. So that's one thing I think we need to do better is, if we're going to push and say, hey, wear a mask, we need to have an education campaign backing that, of why we should be wearing that and how it helps people and how to safely do it versus not to do it improperly. So there is actually a new research study, well, not too new, it's actually in April, and it was respiratory virus shedding in exhaled breath and the efficacy of a face mask. And it was a small group, but it was evaluating specifically COVID-19. And again, it talked about what I'm talking about. When somebody wears something, it knocks down the amount of respiratory particulate, which is coming out of that mask and then hitting someone else. That's the real way that it's working. Versus I'm wearing a mask trying to protect myself. Yeah, it's having some benefit, especially if it's one of those higher like N99 or N95. But if it's a cloth mask or surgical mask or something less powerful that you're wearing, it's not really going to help protect you. It's mainly going to knock those big globules down so you're not portraying that out to somebody else. And then the other thing is that I see we need to educate people better as they're exercising, riding bikes, they're outdoors, they're wearing a mask outdoors. This is not necessary. I mean, really the reason you're wearing a mask indoors is because the indoor air is constantly in suspension when you have something like a heater or AC unit constantly blowing on. Right. And then hopefully, if you're smart, like we do at our clinic, we have air filters all over the place. That's going to help reduce that particulate matter even more. So it's not going to be suspended in air as long. But really the problem is indoors, not outdoors. So when I see a person, riding their bike or running with a mask on, I'm like, oh gosh, that's just horrible. You're just literally, you're increasing CO2, and no wonder you feel like crap and you're more fatigued. Or wearing a mask in their own car when they're the only one in the car, also not necessary because it's your safe environment, right? Remember, the mask is really when you're in your unsafe environment and you're trying to help protect others, like a large grocery store when you have to go out, or like a socializing event where you have to go out. I think the faster we get along with these hygiene things, the faster we don't need to worry about locking certain areas down. Yes, people are going to continue to get this, and that's why proactive medicine is helpful. Yes, all of us will have to be probably exposed to this at some point as we can hopefully reach some form of herd immunity. So take a read through this article. It's really good, but it basically explains, I know it's a smaller article, the N is not large, but it's looking at influenza, rhinovirus, and even the COVID-19 coronavirus and reducing those things. So this is nothing new. I'm going off research, not left, right. Okay. And I see a lot of people bad mouthing it. And I think if you're going to bad mouth it, hey, you propose a better solution. All right. And I want to see some facts and some evidence, not just your opinion, so to back that as well. All right. So what else we got going on here? This growing concern of Kawasaki's like condition related to COVID-19. So in Italy, they reported seeing a 30-fold increase in hospital admission for children. 80% of those have tested positive with COVID-19. So there is some link there. Now, the interesting thing is usually when a child gets Kawasaki's disease, they get this inflammatory condition and we can manage it, and it's not very deadly. In this instance, people have COVID or coronavirus, and it's making this Kawasaki-like condition more deadly. And this happens after their infection. So that's particularly concerning if it's increasing that deadliness. And I think Again, it goes back to oxidative stress, and it's also going back to this clotting disorder. Specifically, we're leaning more and more towards DIC, or disseminated intravascular coagulation, which means this clotting disorder in your system. So if we keep managing people with anticoagulants, antioxidants, and occasionally some antivirals, if we can do them early, not late, our outcomes improve. Ventilators, we've learned, again, I'm going to beat this with a dead horse. It's not a great idea. It's a bad idea. It probably increases our death rate. So what do we have for proactive approaches that we can do that are known with Kawasaki's disease? Well, they're very similar to what I've been talking about for COVID-19. And again, this goes back to balancing the terrain. So one of them I'm going to show you right here is severe vitamin D deficiency in patients with Kawasaki's disease, a potential role in risk to develop heart vascular abnormalities. So most of these children, the reason they're dying is they're dying of heart attacks, vascular issues, just like we see with the COVID stuff. Yet again, another study, and this is from 2016 when we knew about just Kawasaki's disease, not about COVID. And we have new stuff coming out continuously about your vitamin D levels being essential. So if you haven't had your vitamin D level tested in like 6 months, you really should get that tested to make sure you know where you're sitting. Because if you're taking a supplement that's absolute crap, or you're having digestive issues, which is not allowing you to absorb that, really needs to get fixed pretty quickly, because we have quite a bit of research that suggests if your vitamin D levels are sufficient, you're more likely going to get through this without as many problems. So that's one key thing that we need to be talking about. Another one, which we've talked about already, is vitamin C improving endothelial function. So that's blood vessels in patients with Kawasaki's disease. Now, remember, we talked about vitamin C specifically pertaining to COVID-19 in some of my earlier videos. So this also protects those vascular functions. Now, why is this happening? Very, very similar. I wish people would get this. I wish our government would get this. Next article in Rheumatology, Oxford Academics. This was published in 2017. Oxidative stress and Kawasaki's disease. How is oxidative stress involved in acute stage to chronic stage? And bottom line, the best picture that I'm going to show you right here is it shows you exactly what I've been talking about, where you have a healthy condition, homeostasis, this perfect balance in the redox reaction. So oxidation and antioxidants are perfectly balanced, and they can sway. And this is homeostasis, where we get some more oxidation. All of a sudden, we upregulate our antioxidants to control that excessive oxidation. You do this normally if you maximize the terrain, and you're not eating garbage, and you're not smoking, and you're not a couch potato, and you're not basically all the bad things that you shouldn't be doing, consuming tons of sugar. That's going to sway oxidative stress, boom, 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 boom. And then if you get an infection, guess what? More oxidative stress, and it overwhelms any of those antioxidants that you don't have. So really, really critical. Back to greens, back to vegetables, back to all those healthy, proactive habits that we promote in our clinic as part of the foundation of health. And if that does get imbalanced, as you'll see in this diagram, and there's lots of terminology here, but there's a lot of different mechanisms like superoxide dismutase, glutathione that we talked extensively about, vitamin C, vitamin E, polyphenols, things found in vegetables, colorful vegetables, basically. All of these things are antioxidants, and they will bring that oxidative stress down. So again, the same story goes with what's going on in our children. Is what is their oxidative load? And the youngest child that I saw recently that passed, unfortunately, was 8 months old. So then you're saying, well, this is a brand new child. What have they been exposed to? So what I don't know is what kind of formula were they fed? Was it something? I know personally, being a new father, looking at the formulas around are total crap. We have brown rice syrup. We have high fructose corn syrup in them. We have total, pardon my language, shit in our baby formulas. So really for me, for part of the formula that I use with some of my young children in my practice as well, is we look outside the country. Germany makes one without all that crap in it, right? Um, and that's great because in the US, we just love to throw sugar and crap and things. So that's one thing that we can add to the oxidative stress part. Also, what is mother doing? What is father doing? Mother, remember, is passing on a lot of these antioxidants to her baby. So if they're breastfeeding, also, if we're doing breastfeeding, we need to make sure mother is promoting antioxidants, especially so baby gets those as well. So even the young, you can protect them by giving them antioxidants. If we can't give them something orally because they're too young, make sure to push that in the parent so that way the baby gets it. So hopefully this is helpful. Again, you like the information, please share it, hit the like button. If you have any questions or comments or topics you want me to talk about, please put that in the comments below. Thanks, guys. Have a great week. This is another really good incentive to invest in your health. Investing in your health is the best thing you could ever invest in.